Dr. Rhea Hogseth, founder and director of the Pediatric Dental Team Association. So whether you're having to wear a mask at the office or if you're just wearing it to go out on errands and going out the door, there's some issues that are happening when we're wearing a mask so much. So let me take this off and go over with you. Ooh, what is that awful funky smell? Oh, it's coming from my mask. I guess I just need to change masks. The dreaded mask mouth. Whether you have it yourself, or whether you've seen it in your patients at the office, or maybe just your friends and family, it is a common condition because we are all wearing the mask so much. So there are some things you can do to help mitigate the issue. It seems to boil down to dry mouth. Now, once you've ruled out all the other causes that can be from a bad breath, whether it's plaque on the teeth, an infection in the mouth, anything else going on inside the mouth, then the most common cause is dry mouth. The issue is that when most people have a mask on, they're not nose breathing. I know it's hard to do when you're at the office. I get it. You've got an N95 mask on, you've got a surgical mask on top of that, and then you've got a face shield on, making it nearly impossible to get enough air even through your mouth. I get that. But when you're wearing just a surgical mask, try to remember to breathe through your nose. That will help tremendously. Now, what are you going to do if you do have to do mouth breathing? Well, we're seeing the same issues that we see in our offices with chronic mouth breathers. That is an increased caries risk, increased gingivitis, and definitely an increase in malodor coming from the mouth. So what can you do to help? Like I said, nose breathe whenever you can. Another thing is to stay away from caffeine and alcohol because that helps dehydrate you. Now, if you're like a lot of people and you like that caffeine in the morning, I get you. Don't worry about that. Just increase your hydration throughout the day. Reach for water. Don't go with sodas or juice because they're full of sugar, which is going to just feed that bacteria that is sitting on your teeth now with your mouth breather. Because no longer is the saliva bathing your teeth and bathing the tissues in your mouth. So everything is now dry, so the bacteria are sticking even more so to your teeth, and that's why you get increased caries risk and increased gingivitis. Needless to say, it's what helps cause this malodor known as mask mouth. So, do what you can, stay hydrated. I know it's tough to do at the office when you're seeing patients and you've got all that gear on that you've got to take off just to get a sip of water. But do it as frequently as you can. And definitely, when you do take that sip of water, swish it around your mouth really well so you thoroughly wet the inside of your mouth and then swallow it. And then chug-a-lug some more water. But try to keep your mouth as moist as you can. Some people are doing great with mints or chewing gum. That's not always the way you can go in the office because that definitely interferes with being able to speak to patients. But do what you can. And doctors encourage your team to do the same. The three things you definitely want to do is stay away from things with caffeine in it and alcohol that can help dehydrate you. Increase your intake of water so you stay hydrated and rinse your mouth out as often as you can while you're drinking the water. And 3, nose breathe as much as you possibly can. So keeping your mouth closed will allow your own saliva to bathe those teeth and cut down on the bacteria adhering to your teeth, and the saliva helps neutralize the acids they produce, as you well know. All of these things can help you prevent the notorious mask mouth and have nice sweet smelling breath again. This is your Practice Pro from the PDTA, and I'll see you on the next one.